Wie lange muss man die Maske noch tragen in Deutschland? Wie würden Sie das einstufen?
Wir müssen auf jeden Fall uns davon trennen, dass der Herbst, von der Idee trennen, dass der Herbst so sein wird wie jeder andere Herbst auch. Das heißt, ich könnte mir sehr gut vorstellen, dass wir auch im Herbst wieder viel mit Masken arbeiten müssen, weil dann haben wir möglicherweise durch das Risiko in den Innenräumen, durch möglicherweise dann auch in Deutschland ankommende Mutationen, haben wir wieder mit Problemen zu rechnen.
I think it would have been excellent if we could have been more consistently gathering more data on masks, because unfortunately we're still leaning on very few studies, and I just saw a review coming out of the ECDC where they're once again saying the science behind this is very weak. In Sweden we have always worked very much with social distancing and said that.
Somit also die Idee, dass wir uns von der Maske endgültig trennen, die kann ich nicht nachvollziehen, das wird nicht so sein.
The other problem is that many countries with very stringent mask laws are still experience big increases of cases. So,
das ist eine Gefahr, daher müssen wir auch immer wieder erklären, wir dürfen nicht müde werden. Der Abstand muss eingehalten werden neben der Maske. Die Maske muss nur zusätzlich getragen werden, aber dann bringt sie tatsächlich auch mehr, als also am Anfang zu vermuten war. Die Studien zeigen schon, dass diese Übertragung durch Speichel beim Sprechen, einfach die sogenannte feuchte Aussprache, dass das also eine große Rolle spielt bei der Übertragung, insbesondere in Räumen, in Bussen, aber auch in Betrieben und in Geschäften.
When you look at the evidence behind using face masks in society, they are not that great. Very few studies have been done. I saw one from CDC lately that showed that this face mask might not make that much of a difference. The other studies, it's definitely our feeling or our belief that keeping distance is much more important.
Daher wäre da eine Maskenpflicht unbedingt notwendig.
You also have to realize that the experiences in Europe are not that great. I mean, many of the countries that are now looking at huge increase of cases have had legal obligations to wear face masks for quite some time, and which does not say it could have been even worse without the face mask. Of course, we don't know that, but it's also quite clear that face mask is not going to be the silver bullet. It's not going to make that huge difference. And then I think it's a bit dangerous to believe that you can change so much by using face masks. So far, we've been able to cope quite well without them. And then I think it works better in Sweden without. I get mails from many Swedes coming back from other countries and saying, "Oh, happy they are back to be back and being without the face masks." Face mask is problematic, I would say.
Wir brauchen jetzt strikte Maßnahmen. Es muss schnell gehandelt werden.
First of all, we can of course discuss who is orthodox and who is unorthodox. Are the people closing down their society completely, which has probably never been done before? More or less orthodox than Sweden, who is doing what we usually do in public health, giving a lot of responsibility to the population, trying to install a dialogue with the population and achieve good results with that. And the other thing is that the healthcare services have kept on functioning at a very good level. There has always been empty beds. Nobody has ever been denied treatment in any way. Everybody has received the same level of treatment that they would normally do. I think we have shown that schools have a very small effect on the spread of the disease.
Und diese Stabilität bekommen wir nicht, ohne dass wir jetzt den Lockdown deutlich verschärfen. Man muss es ehrlich sagen, ich sehe keinen anderen Weg, als hier mit Ausgangssperren ab 20 Uhr zu arbeiten.
So in many ways the voluntary measures we put in place in Sweden has been just as effective as the complete lockdown has been in other countries. So I don't think that complete lockdown is the way to go for all countries. You might be able to achieve the same kind of results with other means and maybe voluntary means. And I think that the rapid decline in cases we see in Sweden right now is another indication that you can actually get the number of cases down quite a lot in a country without having a complete lockdown.